Hi everyone, thank you for joining me today for this presentation over the effects of an LGBTQ identity. I will be respectful over a 45-minute time period that I promised you. We will be discussing issues LGBTQ population faces, some causes of the suicidal tendencies that this population deals with, the overall effects of the LGBTQ identity. I will also include solutions to help the LGBTQ population, the importance of addressing LGBTQ suicide, the populations impacted by LGBTQ suicide. I also have included a call to action for all educators. Embedded in this presentation is a 20-minute long character strong video discussing school culture and climate. School culture refers to the school's effects on students, including teaching practices, diversity, and the relationships among administrators, teachers, parents, and students. And school culture refers to the way teachers and other staff members work together and the set of beliefs, values, and assumptions they share. A positive school climate and school culture promote students' ability to learn. So school culture and climate work together to help students be successful in any school with any population, but it plays more of a role when we're working with the LGBTQ population. Also in this presentation is a PDF handout that I won't go over the whole handout, but I will go over the highlights of how to assist this population, the do's and don'ts. We'll hit a little bit on the legal aspects of dealing with this population. I will email you this presentation so you can view the entire video and the PDF, as well as referencing the topics that we discussed today. I will be going through this presentation kind of quickly to keep with the 45-minute time period, but if you have any questions, feel free to ask, or you may email them to me and I will get back to you on your answers. And without further ado, let's go ahead and get started. Issues that the LGBTQ population face. Suicide is a public health issue for many populations, but specifically for the lesbian, gay, bisexual, transgender, and questioning population. This population experiences stigma, peer victimization, hardships, and differences at school. These adolescents have a higher risk of mental illness such as depression, anxiety, and non-suicidal self-harm and suicidal ideation than their heterosexual counterparts. These students rely on parental support but may experience homelessness if parental rejection is experienced. These students are also at an increased risk of substance and alcohol abuse. Causes of LGBTQ suicidal tendencies. Nearly 1 in 3 LGBTQ individuals have experienced parental rejection after disclosing their identity to parents, which results in homelessness and suicidal thoughts. School belonging is crucial for these adolescents, and exposure to ostracism, harassment, and discrimination weakens their sense of belonging. Due to the many discriminations these students deal with, substance and alcohol abuse, they may increase suicidality. The effects of an LGBTQ identity. Students who identify as LGBTQ face many challenges. There are several theories that explain these challenges. One theory is the minority stress theory that states these mental health issues and suicidal tendencies are impacted by the degree to which their social environment defames sexual minorities and to the degree to which they have to disguise their individuality. The minority theory asserts that these adolescents' mental health is also affected by the support of close friends and family. If there are weak social ties, then these youth will feel more significant stress and suicidal tendencies. The interpersonal theory of suicide states if an LGBTQ person feels that he or she is a burden on others because of not fitting in with the gender norms of society, lack close relationships, or feel isolated can also elevate their chance of suicide. The structuration theory includes systems that are reproduced by individuals who choose to follow their rules, creating a cycle of oppression for non-normative members such as LGBTQ individuals and can result in suicide. Solutions to assist the LGBTQ population. Interventions such as alcohol and substance abuse include the screening, brief intervention, and referral to treatment model, and the alcohol use disorders identification test. To assist these populations with psychological well being, schools can create safe places for LGBTQ students to retreat to, offer sports beyond the gender norms, and educators, including school nurses, need to be understanding and keep anonymity primary importance. Including LGBTQ information in middle school and secondary social studies curriculum can also be a possible solution. School interventions that are created to encourage belonging, self compassion, and parental support may be vital for these youth who struggle with suicidality. Intervention strategies should be at the primary, secondary, and tertiary levels. The importance of addressing LGBTQ suicide. The stigma around these individuals is what leads to disproportionately high rates of suicide. This population is 4 times more likely to commit suicide than their heterosexual counterparts, and in transgender communities, those rates are higher at 43%. Research shows that students who felt suicidal and ashamed were actually relieved to express their feelings, not encouraged to commit suicide. 90% of the people who commit suicide also have a psychiatric disorder such as depression, anxiety, or bipolar disorder. The LGBTQ population is included in the suicidal statistic that states every 12 minutes someone in the U.S. takes his or her own life, and for every one suicide there are 25 attempts. Suicide is the 10th leading cause of death in the U.S., and the number and rate of suicides are rising. Each year, more than 900,000 emergency department visits are made by people thinking of suicide. The population most impacted include family, friends, classmates, and coworkers if the student had a job. Other people who are close to the individual may also be impacted, such as members of a faith community, teachers, staff, and service providers. And even people who may not personally know the student can be impacted, such as emergency medical personnel, law enforcement, and others who respond to provide support for the family and the community. Consequences of not addressing LGBTQ issues include the students will continue to suffer with psychological and emotional issues such as suicidal ideation and attempts, depression, and low self esteem. These students may also struggle with behavioral issues such as physical aggression, body image, and isolation. LGBTQ students may also struggle academically and have a lower grade point average due to their low self esteem from the discriminations they face. The call to action includes convincing others of their responsibility for supporting the well being of the LGBTQ population. We need to remind people that individuals, families, and schools and the community as a whole have a responsibility to promote a culture that welcomes, accepts, and supports LGBTQ people for who they are. We need to help others associate the relationship between the mental health and suicide risk. There are usually underlying causes for most suicide deaths, and those are complex, which often involve depression, anxiety, or other mental health issues. We need to support discussions about suicide prevention strategies at the website provided. These can include targeted prevention strategies that also play an important role in reducing LGBTQ suicide risk, for example, social media policies that prohibit cyberbullying. We need to explain to others the crucial understanding of resilience. This is not just a factor that can help protect against suicide, but is also a crucial priority when it comes to developing emotional and psychological well being among LGBTQ people. These factors can help foster and strengthen resilience, including family acceptance and support, connections to people who care, a sense of safety, and positive sense of identity as an LGBTQ person. We need to recognize the signs of suicide so support factors can be in place for those at risk. Most people who die by suicide give some type of warning of their distress, which may include ways to kill themselves, talking about wanting to die, feeling hopeless, being in unbearable pain, or being a burden to others, acting anxious, agitated, or reckless, withdrawing from others, and displaying extreme mood swings. Presenting information and intervention resources for those who may be contemplating suicide is important, as young LGBTQ people in particular don't often hear that there are adults who care about them and that they can go for to get help. And evaluating such stories can encourage help seeking by LGBTQ people who may be contemplating suicide. Do not compare suicide to a single factor such as bullying or saying LGBTQ laws or policies will cause suicide. Linking suicide directly to these external factors like bullying can normalize suicide by suggesting that it's a natural reaction to these experiences or laws, and can increase the suicide risk by leading at risk individuals to identify with experiences of those who have died by suicide. This slide shows the Character Strong YouTube video, which discusses all the importance of school culture and climate for all students, not just LGBTQ population. It discusses ways educators can help these students to promote positive school culture and climate. Each of you will get a copy of this presentation so you can refer back to the LGBTQ information from the PowerPoint and this video as needed. And notice the please view video from the minute and 35 seconds into the 20-minute and 4 seconds, because that is the most pertinent to what we're talking about today. And I've also provided the link to view the video if you cannot get it to work through this PowerPoint. And I also have the best practices for serving LGBTQ students. It's a long PDF, but this is a great resource for understanding how to appropriately implement procedures to assist this population. I've listed some pages to view that would specifically discusses how educators can assist these students. It talks a little bit about the legality of working with this population, as well as how to support this population when you get pushback from the community. Um, and I've also included the website to where you can download this PDF if you cannot get it to open up in this PowerPoint. In conclusion, without educator, peer, and parental support, LGBTQ adolescents are victims of bullying, microaggressions, and harassment that can result in declining mental health. The importance of factors such as school, climate, individual differences, and support has gathered attention in the supporting the LGBTQ population. A greater understanding from educators and practitioners alike are needed for these individuals to feel desired and reduce suicidality.